He is an international lecturer and has numerous publications on ophthalmic surgery and pain management. He's been training medical doctors and healthcare practitioners in pain management since 2000 and was interviewed for a PBS documentary in 2013. Please welcome to the podium Dr. Tennant.
Thank you. Okay, thank you very much. I understand that the first thing I'm supposed to do is read this, which says, I do have a financial interest of a product in my talk or with a company offering grant monies for this continuing dental and medical educational program. And I have this slide, which is also the disclaimer. Obviously, as you might guess, I have a proprietary interest in the Tenant biomodulator and its associated accessories, and also in my books, and sometimes I receive financial support for traveling, lecturing, etc. So a question might arise in your mind: why in the world is an ophthalmologist talking to a dental convention? Well, I wanted to share with you my journey. I practiced ophthalmology from 1964 to 1995, and I did the majority of the FDA study for the Vivek excimer laser that's used in LASIK surgery. I did 1,000 cases in the U.S. and 2,000 cases here in Vancouver from 1991 to 1995. I had a lot of fun doing that research, but unfortunately at the time we didn't know that the laser wouldn't kill viruses. And what would happen is I treated in particular a man from India who had scarring in his cornea and had leukemia. And as the laser would come down and strike the eye and remove the corneal cells, it released the viruses. And so they came up like a plume from an atomic bomb. We went through my mask into my nose and into my brain. And so I developed encephalitis and a bleeding disorder. So what happened to me is I got to where I could figure out how to diagnose a patient, figure out what was wrong with them, but I couldn't remember how to write a prescription. In addition, I developed spastic movements, so I would be standing still, and all of a sudden it'd be this sort of thing, which doesn't work really well if you're operating inside somebody's eyeball. So for all of those reasons, I had to quit working at the end of November 1995, and here's how I spent most of my time. I slept about 16 hours a day. I'd have 2 or 3 hours a day in which I could think clearly enough to understand a newspaper, and then like a light switch, it would go off and I couldn't understand it anymore. So I went to the best doctors I could find around the country, and they said, well, you have 3 viruses in your brain. We don't know what to do about it, so don't call us, we'll call you, and good luck. So it became apparent to me that during that 2 or 3 hours a day in which I could think, I had to figure out how to get myself well because no one else was going to do it. And so that's how I began the process of re-educating myself about how the body really works as compared to the way I was trained. So I feel I owe my life to integrative medicine. I was told I would develop Burkitt's lymphoma and that nothing could be done about the multiple viruses in my system. And my blood profile suggested that the end for me might be the summer of 1999. So as the great author Mark Twain said, the rumors of my death have been greatly exaggerated. So here's how I looked at Christmas time in 1999, how I looked at in 2005, and how I looked last Christmas, this June. Thank you very much. So this June, 2 or 3 months away, I'll be 74. And so I hope you can see from the images that things have improved from here to here. And so I'm here to share with you the things that I've learned to get myself well. Now, what I did in the beginning was to go out and buy several cellular biology books. My thought was that if I could figure out how to make one cell work, I could make them all work. And so reading cellular biology books is something I hadn't done for over 30 years. But as I read through these variety of different books, something that jumped off the page at me in each of them was either a sentence or perhaps a full page that said cells are designed to run at a pH of 7.35 to 7.45. So basically any cellular biology book will tell you that. Well, I didn't remember much about pH, and so I began to read about it and discovered that pH is really a measurement of voltage in a liquid. So if you think about the voltage that's driving this computer and these very bright lights that we have here, that goes through a conductive media where electrons are moving through a copper wire, and either the switch is on or off. But if you think about the voltage that is possible in a liquid like this water here, it has a possibility of being either an electron donor or an electron stealer. And so what you do is you use a sophisticated voltmeter and measure the electron availability in a solution. And by convention, if it is an electron stealer, you put a plus sign in front of the voltage. And if it's an electron donor, you put a minus sign in front of the voltage. And so plus 400 millivolts of electron stealer is the same thing as a pH of 0. And a minus 400 millivolts of electron donor is the same thing as a pH of 14. So when cells are designed to run at a pH of 7.35, that is a synonym of minus 20 millivolts. And 7.44 is a synonym of minus 25 millivolts. So what we find is that cells in the body are designed to run in an environment between minus 20 and minus 25 millivolts. Now some people get confused because if you take a cell and put it into a petri dish and put an electrode inside the cell and outside the cell and measure across the cell membrane, you'll measure minus 90 millivolts. So don't be confused about that. So the environment in which cells must work is minus 20 to minus 25 millivolts. Now when you see this slide up here, you might ask the question, didn't anyone ever teach you not to put so many numbers on one slide? Well, I did it on purpose, and the reason is that I wanted to show you the colors of a pH strip. pH strips are very inaccurate, by the way. If you get some from multiple companies and test the same substance, often you get completely different results. So don't really rely on paper pH strips very much. It's much better that you buy a pH meter, which are not terribly expensive. But the colors that you see here correspond to the colors of pH strips. Now, if you look here, you'll see minus 20 millivolts is the same thing as the pH of 7.35. Now, one of the things I want you to learn from this slide is that to make a new cell requires double that, minus 50 millivolts up here. So which has more energy in it, minus 25 or minus 50? Minus 50, even though it's numerically a smaller number, it has twice the energy because electrons are negative, right? So, in order to understand this slide, we want to think about my thumb. So, what's the voltage in my thumb right here? It's a perfectly good thumb, by the way. Minus 25 millivolts, okay? So now I hit it with a hammer, and I destroy a bunch of cells in my thumb. Now the thumb will automatically go to minus 50 millivolts. The healing voltage that's required. And at minus 50 millivolts, the arterial capillaries begin to dilate. And the reason they do that, obviously, is that you need all the raw materials to build the new cells that I destroyed with a hammer, right? So as the arterial capillaries dilate, we have all the signs that we've come to know as inflammation. So the thumb becomes swollen, it's red, it's warm, it has a pulsing pain, and it makes you say bad words. So the process then begins. I have all the voltage I need, I have all the raw materials I need, and I begin to make new cells and replace those that I smashed with a hammer. And then my thumb goes back to being standard, normal, minus 25 millivolts, looks good, feels good, and I'm a happy camper. The other alternative, however, is that I either don't have enough electrons in my body to get up to minus 50 millivolts, or I get up there and I run out of voltage before I finish making all the new cells I need, and so I drop down over here. So chronic disease occurs when you do not have the ability to make new cells that work. The problem is when I'm down over here, it doesn't matter how much surgery I do on the thumb, it doesn't matter how many pills I take, I still will never get well until I have regained the ability to make new cells that work. So what I've just told you is that all chronic disease occurs when you lose the ability to make new cells that work. Let me say that one more time because I think it's very powerful, very important. All chronic disease occurs when you lose the ability to make new cells that work. Now, most people are unaware of how rapidly we are replacing our cells. So you get new cones in the macula of your eye every 2 days. You get the lining of your gut is replaced every 3 days. The skin you're sitting in this moment is only 6 weeks old. Your liver is 8 weeks old. Your nervous system's 8 months old, etc. So we're constantly wearing ourselves out. And those cells have to be replaced. And then if we have trauma, or if we have infections or other poisons, other things that destroy cells, we also have to replace those. And so as long as we're able to replace them, then we stay well. But when we lose the ability to make new cells, then we get sick. And so as voltage begins to drop, of course, the first thing that happens is we begin to feel tired, and whatever organ that we're talking about begins to have some early symptoms of malfunction. And then over time, as the process of inability to replace the dead and dying cells occurs, then we get what is known as disease. Now, basic to all of the chronic disease that you'll find is a lack of voltage. It's very, very rare to find any sort of chronic disease where you don't have low voltage in the organ in question. So if we go back to this other slide, what we began to see here is that normally we run here at the 20 to 25 millivolts of electron donor, and then we can get up to the 50 millivolts to make new cells, and all is fine. But as voltage begins to drop, first we get tired, and then as voltage drops lower and lower, a lot of bad things begin to happen. Now, one of the things that happens when voltage drops is chronic pain. I told you that at minus 50 millivolts we have a pulsing pain, but as voltage drops and the voltage is low, we get that it hurts all the time kind of pain. And what we come to realize is that pain is simply a symptom of abnormal voltage. Once we realize that pain is just a symptom of abnormal voltage, we have a very powerful tool in order to deal with pain, don't we? We simply put in enough electrons to bring the voltage back to minus 25 millivolts and the pain goes away. But if we quit putting the electrons in, it'll come back because we haven't gotten up to the minus 50 it requires to make new cells. But if we get up to minus 50 and we have all the raw materials necessary to make cells, then we make new cells and we heal the process. So the body knows how to heal almost anything by making new cells if you give it the voltage and the raw materials necessary. The only thing that doesn't happen when you make new cells is to get rid of scar tissue. A new cell is not strong enough to push a scar out of the way. So when scarring occurs, we can't overcome that, but we can overcome almost everything else. Now, as voltage begins to drop, not only do we get pain, but we get reduced oxygen. The amount of oxygen that will dissolve in water is dictated by the voltage of the water. So if I were to take and put a tube in here and start bubbling oxygen into this water, the amount of oxygen that would dissolve is dictated by the voltage of the water. So if I lower the voltage of the water, oxygen comes out of solution and goes away. But if I raise the voltage of the water, more oxygen would go into solution. So again, the amount of oxygen that we have available in cells is dictated by the voltage of the cell. Now, the other thing that you should remember is that if you're going to have oxygen go into solution, guess what? You have to have some oxygen in the neighborhood. If you don't have any oxygen in the neighborhood, then even if the voltage is high, there's nothing to go in there. So what controls that? Nitric oxide. Nitric oxide controls the dilation of our arterioles and thus the availability of oxygen. And nitric oxide levels began to drop from childhood on toward old age, and generally past the age of 40, everybody's deficient in nitric oxide. And so one of the things that's high on the list of things I have to do in order to get people well is to fix their nitric oxide levels. Now, the next thing that happens when voltage begins to drop is the efficiency of our metabolism. Inside the cell, voltage is necessary to make things work, and we have a rechargeable battery system inside of our cells. When that battery is charged up, we call it ATP, and when the battery is discharged, we call it ADP. And because we need a battery recharger inside the cell, we have this system called the Krebs Cycle. And so for every unit of fat you put into the Krebs Cycle, you get enough electrons to charge up 38 ATP batteries, if oxygen's available. But if oxygen is not available, you only get enough electrons per unit of fat to charge up 2 ATP batteries. So it's like going from 38 miles to the gallon to 2 miles to the gallon in your automobile. When oxygen drops, that's what happens to the efficiency of your cells. Well, what controls the level of oxygen in your cells? Voltage. So again, voltage is the controlling factor of the efficiency of your metabolism. Now, in addition, when voltage drops, each of us contain about 1 trillion bugs. And those bugs are suppressed when oxygen is available. But when oxygen drops, those bugs wake up. And when the bugs wake up, they want to have lunch. They want to have you for lunch. Because bugs don't have teeth to take a bite out of your cells, the bugs put out digestive enzymes to dissolve your cells. And as they're dissolving your cells, they're having a good time, but guess what? You are sensing some sort of illness, right? And not only do these digestive enzymes that they put out function locally, but they get in your bloodstream and go everywhere else and cause damage. For example, if you have strep bacteria having a picnic on your tonsil, they're having a good old time, but how do you feel? You have the world's worst sore throat, you have fever, you have nausea and vomiting, and diarrhea and a headache, and if things go on, those digestive enzymes get into your bloodstream and go down and scar your heart valves and scar your knees, you see? So it's these digestive enzymes from the bugs that cause a lot of damage. And in my opinion, all autoimmune diseases are not really autoimmune. They're simply these digestive enzymes coming from cell wall deficient organisms that don't cause typical signs of chronic infection. Well, as voltage begins to drop, when we get down to plus 30 millivolts, we get cancer. So we really have described everything from tiredness to a malignancy, and it's all based on and controlled by voltage. Now, the things you have to recognize then is that every organ in the body has its own power pack. Because the human body is a portable electronic device, like all electronic devices that are portable, it requires a battery pack. And so you have, each of your organs has its own personal battery pack. And these battery packs are our muscles. Now, muscles are piezoelectric. So what does that word mean? If you were to take a piece of quartz and you squeeze it with a pair of pliers, it emits electrons. So any substance that, when distorted, emits electrons is called piezoelectric. And our muscles are piezoelectric. So every time I do this, I'm generating electrons. So every time I exercise, my body generates electrons through piezoelectricity. In addition, my muscles are rechargeable batteries. So when I simply exercise, then all of my battery packs begin to recharge themselves. And I'm just going to show you an example of those. This, for example, is the spleen circuit. And so you will see that it's all these circuits start in either the hands or the feet. In the case of the spleen and stomach, they start in the feet, and they go to the ankle, and then from the ankle to the knee, and from the knee up to the hip, and so forth. So the poles of the muscles are at the horizontal diaphragms in the body. So as you know, each battery has a plus and a minus pole, right? And so we have, each of these muscles has a polarity, and they are stacked together exactly like you stack batteries inside a flashlight. And so this circuit, called the spleen circuit, starts down in the foot, goes up through the inside of the knee, as you see, goes to the hip, and once it gets up to the hip, goes through the back, and then it picks up this muscle back here, and goes on up toward the neck, where eventually it's going to join up with what's called the stomach circuit. And like all batteries, there are terminals that you can go tap into to both measure the voltage of that battery system and or insert electrons just like you would in your car battery. So as you see here, this spleen circuit ends up in the frontal lobe of the brain, And by the way, you remember I told you that I got to where I couldn't think anymore? Thinking's the frontal lobes, and it's because I had a root canal in number 14, which is the spleen stomach circuit, which dropped that voltage down. As I told you also, this circuit should be running at minus 25 millivolts. When I got the tools to measure it, my brain was running between minus 2 and minus 4 millivolts, which is why it didn't work anymore. And it didn't work because it was shut down by number 14 root canal. 48 hours after I had the root canal pulled, my platelet count, which had dropped down to 30, should be 150 to 350, so I was bleeding under my skin. 48 hours later, the count went back to 150,000 normal. So it was simply the only reason that I got sick was that root canal in number 14 shut down the power in the power supply to the frontal lobes of my brain. Well, here you can see the stomach circuit. So the spleen goes up, the stomach comes back down, and again you can see many of the associations here. For example, in my field of ophthalmology, the macula receives its power supply from this stomach circuit, and so I can easily now reverse macular degeneration, except for the scarring that's there, by simply restoring power to the stomach meridian and supplying the nitric oxide and the other things necessary to make new cells. And I can prove this by taking sophisticated thickness measurements with what's called an OCT, which is accurate to 1 micron, and I can prove that in 4 days I can reverse the macular degeneration. So it's another example of how well this system can work by simply recognizing the low voltage that's in the power supply to the organ in question. So when I see a patient that comes in with a chronic illness, the first thing I want to do and the first thing my mind goes to is what is the power supply to that organ? So somebody comes in, they have heart disease, what's the power supply to the heart? Somebody comes in with liver disease, what's the power supply to the liver, et cetera, you see? Because once I identify the power supply, I can go from one end of that power supply to the other and find out why its voltage is low. And when I fix that problem, then and give all of the necessary raw materials to make cells, then get out of the way and let the body heal itself. So you can see then these power supplies. Now, one of the things that's critical to understand is that every one of these power supplies goes through a tooth or some combination of teeth. So, for example, in my personal case, I had a root canal in number 14, which shut down the spleen circuit. And so because the spleen circuit not only supplied voltage to my frontal lobes where I couldn't think, it also caused my spleen to kill my platelets because it's, again, no power on that circuit. And so I had both inability to think and a bleeding disorder. It's time for my lecture. So I guess I should start over again, right? So let me emphasize to you once again that chronic disease occurs when you lose the ability to make new cells that work. And so that leads us obviously to the question of what does it take to make a new cell? And it takes minus 50 millivolts of voltage. The inside of cells is made from amino acids, and the body's source for amino acid is that stomach acid breaks the proteins you eat into amino acids. The outside of cells are made of fat. To absorb fat, you have to have bile, so it means you have to have a liver and gallbladder that work. And you have to have vitamins and minerals, and those are under the control of fulvic, F-U-L-V-I-C. Fulvic controls the availability and egress of vitamins and minerals into the cell. You have to have oxygen, as I mentioned, that's under control of both voltage and nitric oxide. And then, of course, you have to have water, and water inside a cell is not H2O, it's H3O2, which is an electron donor, and a very unique fourth phase of water, and that's why drinking things other than water doesn't work the same. So I'm skimming through these fairly rapidly because of the amount of time I have available to talk to you this morning. For those of you where I piqued your interest, we'll be talking about this in more detail this afternoon. So how do we measure the voltage in the body? Well, the wiring system of the body is the fascia. As you know, around every muscle you have fascia, around every organ you have fascia, etc. So we have this wire that goes up our back and down the front, made of fascia, and then from that it goes around every muscle. So the stocking of fascia around every muscle is the wiring system of the body. And then it goes down to the fascia that's around every organ, and from that there are little fascial wires that go down to every groups of cells. Now, one of the interesting things about fascia is that fascia is a semiconductor. So what's a semiconductor? A semiconductor is a collection of molecules that have excess electrons but are designed in such a way that the electrons can quickly and easily move from one molecule to the other. So semiconductors move electrons in basically nanoseconds. That's the reason that if you put an essential oil on your big toe in a nanosecond, it's already up in your brain, because the frequencies of that move through the fascial wires, which are semiconductors, and move it throughout your system so rapidly. And that's, of course, also the way information goes throughout the body, and, of course, it moves the voltage throughout the body. Now, how do we measure things? Well, we can take devices such as this one that I developed, where it has a voltmeter mode, and simply tap into the terminals of each battery pack system. Just as if you wanted to know the voltage in the battery in this clicker, I could take it out and put a voltmeter on it, right, and measure it. Or the same with my car battery and so forth. So we can just simply tap into the poles and measure the voltage in that power pack, which gives us an indication of what's going on with the voltage in the associated organs. And then, of course, we also have the ability to switch it into a mode in which it can insert electrons in the waveform and pattern that is required to transfer energy to the cell membranes. Not every waveform, in fact most waveforms, do not efficiently transfer electrons to cell membranes. For example, a TENS machine treats pain simply because the frequencies and the signal coming out of a TENS machine blocks the nerve going from where it hurts to your brain, so your brain doesn't know that it still hurts. Whereas when you put in frequencies and waveforms that will increase the voltage and the ATP in cells, it causes the cell to heal, and so that is a permanent fix. So you see there's a big difference between the different kinds of electronic devices that are out there. You have to realize that a TENS device simply works like a pain pill, in that the brain no longer knows that things are hurting and degenerating. Did I explain that well enough? You understand the difference? Okay, so how's the body really wired up? Well, as I mentioned, we have this wire that goes up the back and down the front, and then on that particular wire we have regional terminals that go to each organ. So we have these terminals like this, and so there's one in the front and one in the back. So the one here between my eyes and the one at the base of my skull are the power terminals that provide all the voltage to everything that's going on in my skull. The one between the top of my breastbone and my C7 provides all the voltage for everything that's going on in my neck and in the trachea. And then the one at T5 and the mid-sternum provides all the power to everything in my chest, including my heart and the lower part of my lungs, and so forth. So we have these various terminals, regional terminals, that provide voltage for everything that's going on in that particular circuit. And so one of the things that makes things much more understandable about how things in the body work, if you understand the Tesla resonating circuit. Tesla invented this resonating circuit back in the early 1800s, and it is the thing that makes essentially all electronics work. So my computer wouldn't work, this microphone wouldn't work, were it not for a number of Tesla resonating circuits. So a Tesla resonating circuit is when you take a capacitor and wire it onto a square with a coil. A capacitor is an electronic device where you have two conductive media separated by an insulator. And what happens when you have that particular system is that it will store electrons. So a capacitor is really a mini battery. And then, of course, a coil, when you run electrons through a coil, it creates a magnetic field. So what happens in a resonating circuit is that the electrons will move from the capacitor eventually completely over into the coil, and then they reverse and start going back and filling the capacitor again, and then they come back the other way, so they go back and forth. This is a Tesla resonating circuit. Well, the body is, the organs of the body, half of them are capacitors and half of them are coils. So it works out that all of the coils of the body are wired to the anterior surface of the body, and all of the capacitors are wired to the posterior surface of the body. And when you look how they're really wired up, this is the wiring schematic of the human body. So the same organs are always wired to each other, and of course this has been known in Oriental medicine for 5,000 years or so. That the lung is always wired to the large intestine, the heart's always wired to the small intestine, the spleen and pancreas are always wired to the stomach, the kidney's always wired to the bladder, and then on top and bottom we have liver wired to the gallbladder. And so we have then a series in the body of Tesla resonating circuits, each of which can communicate electronically with all of the others. So one region of our body knows what the other regions are doing through these electronic circuitries. Now, of course, our body is designed to be in resonance and in tune with each other. But if we go in and we cut out part or all of one of these coils, guess what? It's no longer in resonance. So if you go in to your stereo and lift the lid off and take some snippers and snip off part of one of the coils in there, it may still work, but it's not going to work near as well as it used to, right? It'll be out of resonance, so the sound will not be the way you want it. And so it is with our bodies. We should make every effort we can to keep all of our body parts because they came tuned in resonance. And the body does the best it can when it goes out of tune, but out of tune is out of tune, right? So now, one of the things that's important to recognize is that as these acupuncture wires or these power packs, if you please, go through the body, they always go through the teeth. And one of the things is that teeth are critical in the way that the circuitry in the body works. So if we think of just a standard Tesla resonating circuit, we have a power supply that puts voltage in, we have a capacitor, we have a coil, and then we have a circuit breaker. And so the voltage keeps going back and forth, as I told you, unless something happens to short it out, in which case the circuit breaker trips. Now, in the human body, we have here the solid organs, we have here the hollow organs, we have the muscles, battery stacks providing the power, and the teeth are the circuit breakers. So when you have an infection in a tooth, that acts as a circuit breaker and takes down the voltage in that circuit. That is why, in my practice at least, almost all chronic disease is associated with an infected tooth, either under a filling, under a crown, in a root canal, etc. And so it's very rare to find any sort of significant chronic illness in which you don't find that a circuit breaker is blown, namely that you have an infected tooth. And as you can see here, this is the diagram that shows you which teeth are associated with which organ. And then from there, these wires go down to the various organs in the body and form Tesla resonating circuits. So this is the way we're wired up. One of the interesting things about the way that we are wired is that we have these central terminals, but we also have left and right lateral terminals. And one of the fun things about them, for example, is that if you look at the pattern that's right here on the front of the body, it's almost exactly the same as the tree of life in the Kabbalah. So there are many similarities throughout systems. You will also find that in this pattern of the so-called tree of life as well, are these sacred patterns that within each of these you have, these are all fractal, which means that you can make them as big as you want to infinity, as small as you want to infinity, and they're all the same, which has the ability to implode energy, which is a subject of another interesting conversation that we can't go into this morning. So the fact then is that some of the organs in the body have more than one power supply. For example, the ear itself has 3 different power supplies. The sympathetic nervous system, the small intestine, and the gallbladder system all provide the voltage to the ear. So if you have someone who has hearing problems, you will find that one or perhaps all of those have low voltage. And the way you restore the hearing is simply figure out why the voltage is low in each of those. And the reason that voltages drop are, over 90% of the time will be some combination of the following. Inadequate amounts of thyroid hormone T3 and T2 at the cell level. Number 2 is a dental infection. Number 3, a scar that causes a short or a ground of that battery pack. And number 4 is a liver that is clogged up with the bile that's turned to wax, so that the liver inadequately removes toxins from the body, because all toxins in the body are electron stealers. And so if the body can't get rid of them, they collectively take down the voltages. So almost everybody with any chronic disease will have some combination of those things functional. So let's see, 15 minutes left. I was told I should talk until 50% of you are asleep. I'm almost there, I think. So let's finish up by talking about the bowling ball syndrome, because this particular syndrome has meaning not only for all of chronic disease, because almost all chronic disease also begins here, as I'll explain to you this afternoon, but also it has great ramifications in the way that the teeth work. Now, the bowling ball syndrome was given this funky name by an Irish osteopath named Robert Boyd, who said the head weighs the same as a bowling ball, and because it weighs so much, the body will always put the neck under the center of gravity of the head so it won't fall over, and will accept whatever pain and misery it has to in order to keep the head upright. Well, it turns out that Boyd was correct in his description of the anatomical position that one gets into when you have this syndrome, but he was not correct in the mechanism of cause. But to understand some of this sort of thing, we need to start with the idea of cranial-sacral therapy, which was invented in Dallas in 1975 by Roland Becker, an osteopath who then taught many of his colleagues. And one of those he taught was John Upledger. The thing that's different about Becker and Upledger is that Becker would only teach physicians how to do this. Upledger taught anybody who wanted to know, and thus Upledger is generally credited with popularizing the idea of the cranial-sacral pump. Now, to understand this pumping mechanism, you have to understand a keystone. If you were to stack up a series of stones into an archway like this, the stone at the top determines the position of all the other stones. So if you take the stone at the top and move it, well, then this other stones move, don't they? Move back and forth. So wherever you put that stone determines where it goes. Well, in our skull, the keystone is the sphenoid bone, and all the other bones rest on it. So the arch is upside down, so to speak. So what you see in the picture here is that all of the cranial bones rest down on the sphenoid bone. And if you look at this particular, whoops, let's see if I can get it to play. I don't know if it's going to want to play or not. Was it playing? Oh, it just wasn't playing over here. Sorry about that. Now I stopped it. Let's start over again. Let's see if it'll go from here. Ah, there you go. So now if you look inside of the skull here, what you see is here's the sphenoid bone and all the other bones resting down on top of it. Now, I bought this skull in 1968 when I went into practice, and it was still legal back in those days to buy real skeletons. So this is a real skeleton. Here you can see that the joints are designed to move a few millimeters, but then be very strong. It's a really unique kind of joint, isn't it? Well, inside this particular joint is an on-off switch. So when the joint comes together, it turns the switch on, and it causes the cells that make cerebrospinal fluid to secrete fluid inside of the dura. Now, you know the dura is a big, long, skinny, rubberized balloon, right? And so as you begin to fill that balloon up with fluid, it begins to expand, and when it does, it opens this joint and turns the switch off. When the switch goes off, it quits making the cerebrospinal fluid, and slowly the fluid drains out through the veins, and the balloon gets smaller. The joint comes back together and touches, turns the switch back on, and so we have this system of filling and draining of the dura about 10 times per minute. And so as it fills and drains and fills and drains, it creates a pumping vortex that goes through the various canals in the brain and down through the spinal cord, creating a pumping mechanism that's come to be known as the cranial-sacral pump. Now, the cranial-sacral pump is one of the great voltage generators of the body, and so when it's shut off, you lose one of the things that creates voltage for your system. Also, when the pump is shut off, your brain and spinal cord have to use somewhat stagnant cerebral spinal fluid, and thus is not nourished as well. Well, here's Dr. Boyd, and what Boyd described is that when the center of gravity of your head is in the middle where it should be, that your brain tells your body to be in a normal position, but that if the center of gravity gets over to the side because you got banged on the head and your sphenoid got stuck over there, that your body does this to get over underneath it. So C1 and C2 slide over, your back becomes S-shaped, your pelvis rotates, you have a short arm, you have a short leg, and so forth. So you're in this position, which Boyd described. And when you have that happen, what you see is that you have that your ears are on crooked, one is higher than the other, one shoulder is higher than the other, and that your pelvis is rotated, and the other things that I mentioned to you. What happens is that the two sides of your face are asymmetrical, so you have your photographic side and your ugly side. We did one of the kind of a fun thing once. We took Photoshop, and we'd take a picture of people straight on, then we'd divide it down the middle and throw that half away and duplicate this and flip it over, and then do the opposite, and it was two different people. Looked completely different. Then we fixed the bowling ball syndrome, as I'm going to describe to you, waited an hour and went back and took their pictures again, and now when we split it down the middle and duplicated and turned it over, it was exactly the same. So the two sides of your face became completely symmetrical once we fixed this. And I'll show you this afternoon how to fix it. It only takes 2 minutes, and it doesn't hurt at all. Well, one of the things that happens is that the jaw moves to the side, giving you TMJ disease. One eyelid is droopy, and the opposite maxilla will be flattened. One ear canal is lower than the other. You get obstruction of the ocular canal, and often that contributes to glaucoma. You get kinking of the eustachian tubes with ear infections. You get sinus obstruction, nasal obstruction, snoring. C1 and C2 moving to the side gives you what are called tension headaches. Your spine is curved, which causes extrusion of the discs. One shoulder is higher than the other, making one arm seem short. One scapula is higher than the other, gives you pain in the interscapular area. Now, you dentists and dental assistants will often be in the same posture that I was as an ophthalmic surgeon. You know, I would spend many hours a day like this, as you do, and I would get this enormous pain between my shoulders to the place that I actually wore a monitor seeing if I was having heart disease. And it was nothing more or less than that I had the bowling ball syndrome, and because of the way that the scapula were higher than the other, when you put your arms out like this, you get this pain. And I'm sure many of you know exactly what I'm talking about. You can get the same thing when you drive a lot. Get this pain there. It's simply you eliminate that pain by fixing the bowling ball syndrome. The pelvis is rotated, which gives you low back pain, and because of the position you get into, you carry all your weight on one hip and one knee and one ankle, so you wear that hip out. The shift of the weight makes you more clumsy. Obviously, athletics is based on balance. Almost all of athletics, whether it's riding a horse and not falling off, or whether it's playing golf or basketball or karate or whatever, it's all about balance, isn't it? And if you got all your weight on one side, guess what? It's hard to be balanced. And so you're not nearly as good an athlete as you would be did you have gotten your bowling ball fixed. Which again, we're happy to do as much as we can. It takes about 3 minutes a person to do it. The locking of the cranial-sacral pump causes the nervous system to use stagnant fluid, and you get decreased in function, and you get migraines. Generally speaking, if you have a person that has migraines and you fix the bowling ball, about 70% will be cured just doing that. The other 30% you have to fix their thyroid and adrenals and their nitric oxide. So the Tmj joint, of course, is a ball and socket joint, as all of you know. And what happens when you have the bowling ball syndrome is that the socket moves away from the ball, and so it rubs in there and causes arthritis, inflammation in the joint. Well, if you look at the mandible from below, of course, the mandible is a fixed piece. It is a fixed piece of bone. So if the socket moves away from the ball, as you might guess, you're going to get rubbing. But in addition, this is what causes bite problems. When this joint becomes unstable because the skull is deformed, then the mandible doesn't fit the way it's supposed to and doesn't fit the same way every time it comes closed. So a person will come in and say, hey, doc, I'm banging here, and so you grind that off. They come back a week later and they're banging over here, and you grind that off. And they come back a week later and now they're banging up here, and you grind that off, and you're chasing your tail. You never get it right, and it's because the joint is unstable, and the joint's unstable because they have the bowling ball syndrome. So the next time somebody comes in telling you that the bite's incorrect, stick your fingers in their ears. If their ears got one ear higher than the other, you know what the problem is, don't you? It's the syndrome, and it's easily fixed. So it's my personal opinion that a dentist should never seat a crown or do any bite adjustment until you first check to see if the bowling ball syndrome is present, and then fix it so that everything is the way it's supposed to be and not in an unstable situation. Well, I'm running short on time, so I'm going to skip through a little bit of this. I just wanted to tell you that there's an enormous amount of literature about the effects of dental infections and chronic disease. Unfortunately, many dentists are like us physicians. We get our medical education from drug reps and don't read our journals. And I suspect dentists have some of the same problems. But there's an enormous amount of literature, as you see as we go through here, about the role of dental infections in chronic disease. And one of the things that really I found very fascinating is this business about the dental pump. This is work that was done by Steinman at Loma Linda. And what they did was they injected dye into the various organ systems in animals, and found that within 6 minutes the dye would show up in the pulp of the associated teeth, and within 30 minutes the dye was in the oral cavity. What this was able to show then is that within each tooth you have a pump that pumps fluid from inside the tooth to inside the mouth, which of course prevents all of the garbage mouth that each of us has from going into the teeth. And so that caries are more a result of failure of the pump than they are of the diet. So one of the things that I have found very fascinating is that as I began to consider what would cause the dental pump to fail, I knew, well, it had to be that the voltage had to be insufficient to keep the pump going. And so I began to notice that when I did a time sequence of people's problems, that what I could find is that a kid would fall off their bicycle at age 6 and get a scar in a certain meridian, a certain circuit. And then a few years after that, they got the first decay in the associated tooth in the same circuit. And then they get a filling, and that would last a few years, and then they get another filling, that'd last a few years, and they eventually get a crown, and that lasts a few years, and then eventually the crown was a problem, and or they got a root canal. And so as I started doing timelines of energetic timelines on my patients, what I found was that in the majority of cases, you could trace whatever chronic illness a person might have, even in their 60s, all the way back to it started when they fell off their bike when they were 6. Isn't that interesting? And so it is uncommon for me to find a person that has an infected tooth that doesn't have a scar in the same power pack. Now, I'll teach you this afternoon how to fix scars. Again, that takes 3 minutes to open that circuit and get those semiconductors realigned so they work again. But it's great fun to fix that. And of course, from a dentist standpoint, if you wanted to figure out how to keep that tooth from getting infected again, getting the decay again, you really want to think about, okay, what scar took down the voltage and is affecting the pump. Does that make sense? So it would be, in my view, quite advantageous if a dentist had a dental assistant that could identify the scars that are causing much of the dental problems. Well, I've got 3 minutes left. I have to tell you that obviously from my personal experience, I would not be standing here. I would still be back home happily removing cataracts and doing LASIK surgery in my ophthalmology practice had I not had a root canal in number 14. That's what took me down. That one root canal put me in bed for 7 years. And as I mentioned, within 48 hours after having it removed, I started getting well. So the problem that I see is that it's uncommon for me to see any sort of serious illnesses in my patients without finding a root canal in the same circuit. Of course, root canals are iatrogenic avascular necrosis, aren't they? I mean, by definition, you go in and you rip out the artery. The only difference between traditional avascular necrosis, like a diabetic would have, and a root canal is that you also take out the nerves so they don't know that it hurts. The same is true, of course, as appendicitis. Appendicitis is generally avascular necrosis of the appendix. So when you cause avascular necrosis, it essentially always gets infected. Now, most of you are probably familiar with this article published in the Journal of Endodontics, in which they took 19 different people who were going to have wisdom teeth pulled, and they did a root canal on one side, and then they waited 150 days and pulled both teeth, and then looked at the two different ones. In the tooth that had nothing done to it, they had 1.1% of the dental tubules were infected, whereas in the root canal teeth, 39% of the dental tubules were infected at 5 months. So again, avascular necrosis always gets infected. Now, one of the tools that I use, by the way, to help me as a physician rather than a dentist figure out which teeth have decay in them, works for me, but it only works in teeth that have metal in them. But you simply buy a voltmeter that measures in millivolts, which you can buy at Radio Shack or Fry's or any of those places for about $40. You put the one electrode against the buccal mucosa and the other one on the metal. Again, these teeth should be running at 25 millivolts. But I can tell you now with 10 years experience of doing this, that anytime you see a number over 100 millivolts, you can take it to the bank that there's decay under that filling or under that crown. And so it's in my office, then I always measure the teeth that I'm able to measure, and then relate that to the voltage in the organ power supplies, and almost always there is a match. That one of the reasons that the voltage is insufficient in a power pack is that an infected tooth has acted as a circuit breaker and taken that voltage down. Well, I'm out of time, so before the hole opens up here and I fall through the floor, I'm going to have to, again, thank you for allowing an ophthalmologist to come speak to a dental convention. Be well.